Hi, I'm Liz Perez, and I'm going to share some names of some of the most common female reproductive tract disorders. These include uterine fibroids, ovarian cyst, and polycystic ovary syndrome, which is most often referred to as PCOS. You're going to learn much more about each of these throughout the duration of this presentation. Not only will you hear about the pathophysiology of each disorder, you're also going to learn more about signs and symptoms associated with each one, which can actually range from none to severe, oftentimes affecting one's work and lifestyle. Additionally, we will go over expected lab findings, diagnostic testing, common medical treatments, and medications that are commonly used in treating these disorders. Thank you so much for joining us. Now let's get started.
Hello, my name is Aquisha Malone, and I'm going to be going over uterine fibroids. Uterine fibroids are benign tumors found in the uterus of women. They can range from up to the size of a melon to a pea size. They can also grow suddenly or slowly, and it can shrink or remain the same size for years. Eating a diet high in red meat, consuming a lot of alcohol, and having a diet low in vegetables will encourage fibroids to develop. African American women are more likely to develop fibroids. Also, it can be hereditary. Signs and symptoms of fibroids are heavy menstrual bleeding, severe menstrual cramping, prolonged menstrual periods, pelvic pressure or pain, infertility, also passing large clots during your menstrual period. The medical management for fibroids are prescribing oral contraceptives to decrease menstrual bleeding, prescribing medications that inhibit estrogen and progesterone in order to shrink the fibroids, performing uterine artery embolization, performing surgery to remove the fibroids from the uterus, or a hysterectomy to remove the uterus itself.
Uterine fibroid medications. Gonadotropin-releasing hormone agonists treat fibroids by blocking the production of estrogen and progesterone. Menstruation stops, fibroids shrink, and anemia often improves. Progestin-releasing intrauterine devices, or IUDs, are T-shaped plastic frames that are inserted into the uterus. They prevent pregnancy, can relieve heavy bleeding caused by fibroids, and they are for symptom relief only regarding uterine fibroids. They don't shrink the fibroids or cause them to disappear. Tranexamic acid is a non-hormone medication, helps ease heavy menstrual periods, and is taken only on heavy bleeding days. Typically, uterine fibroid medications cause hot flashes. They're used for no more than 3 to 6 months due to long-term use causing bone loss, except the IUDs, and it can shrink fibroids before a planned surgery.
Hi, I'm Ruby, and I'm going to be talking about ovarian cyst. Ovarian cysts are fluid-filled sacs in the ovaries. There's two types of ovarian cyst. One of them happens because the follicle, after releasing the egg, it does not shrink back down to the size it's supposed to. And the other type of ovarian cyst is when the follicle does not release the egg and it just keeps growing and it forms a cyst. These are not painful. They usually go away in the rupture within 1 to 3 months. Some signs and symptoms of ovarian cyst are pressure or swelling in the abdomen, the problem emptying the bladder or bowels, dull aching in the lower back, pain during sexual intercourse, and painful menstrual periods, and even abnormal bleeding. So medical management would be waiting for the cyst to resolve on its own, or if it's severe, surgery can be done, and also oral contraceptives just to prevent the cyst from forming.
Ovarian cyst medications. So there are not many medications that strictly target ovarian cysts. What you do have are hormonal contraceptives, also known as the birth control pills, They prevent ovulation, prevent more ovarian cysts, but they will not shrink an existing cyst. Then you have your non-steroidal anti-inflammatory drugs or NSAIDs, and these treat ovarian cyst pain as well as period cramps.
Polycystic ovary syndrome is caused by different factors. The typical characteristics of this syndrome are increased levels of androgens, insulin resistance, and irregular menstrual periods. Some signs and symptoms would be irregular or absent menstrual periods, extra hair growth on the face, acne, weight gain and difficulty losing weight, patches of dark velvety brown skin on the neck, under the arms, and in the groin area. Some medical managements for polycystic syndrome would be ultrasounds, prescribing metformin if they have high blood glucose, spironolactone to lessen the hair growth, and hormonal therapy like oral contraceptives to decrease the amount of cysts they can get, and lifestyle changes.
PCOS medications. To regulate periods, the healthcare provider may provide combination birth control pills. These will regulate hormones, lower the risk of endometrial cancer, correct irregular bleeding, excess hair growth, and acne, and they will also prevent pregnancy. To promote ovulation, the healthcare provider may prescribe clomiphene. This is an oral anti-estrogen medication, and it also a breast cancer treatment that stimulates the ovaries. Then you have gonadotropins, and these are hormone medications given by injection. Next, you have progestin therapy. They're taken for 10 to 14 days every 1 to 2 months. They regulate periods, but they do not prevent pregnancy.
Diagnostic tests. Pelvic examination is to feel the size, shape, and position of the uterus and ovaries. The vagina, cervix, fallopian tube, and rectum are also checked. Hysterosonography uses sound waves to produce pictures of the inside of the woman's uterus and helps diagnose many problems, including unexplained vaginal bleeding, infertility, and repeated miscarriages. Ultrasound is to detect problems with pelvic organs, monitors pregnancies, and evaluates fertility problems. HSG, a test that uses dye to visualize the internal shape of the uterus and shows whether the fallopian tubes are blocked. And then you have your hysteroscopy, examines the inside of the cervix and the uterus using a thin, lighted, flexible tube. And these are your diagnostic tests.